without doing the short answer?
What's that?
Are we allowed to turn something in without doing the short answer?
Is it connected with the others, with the worksheet, other worksheets that you're gonna have?
This is for chapter 4.
Chapter 4.
Like, can I do the short answer? Can I turn it in and then do the short answer when y'all are doing it?
Yeah, you can do that. Wow.
I did, like,
Impressed.
3 chapters. But I did do some of the labs. I saw it.
Morning. I'm gonna start off with the short answers on chapter 17. Oh, 19, chapter 19. Any questions on the lab? Chapter 19. That was kind of easy. So basically, chapter 19 is all musculoskeletal. Just remember different types of drug class for those. Of course, there's NSAIDs. Usually ibuprofen. There's your opioids.
What is chapter 19's test over?
It's just going to be over the sheets that I gave you on the medications. Going to have different questions. You know, what's the brand name for Tylenol? Or what's the generic name for Tylenol? What's the brand name for Tylenol? What are the indications for acetaminophen? What are some side effects to acetaminophen? You know, those type of questions. So yes, you need to know the brand, the generic name, and the indications, the drug class that it falls in, and side effects. So it'll be multiple choice questions, so you'll have your choosing of which one you think is the right answer. And we'll do plenty of review before that as well. All right, so short answer starts on page 282. Yeah, I'll pull something up real quick. All right.
I was gonna ask, on Thursdays or Mondays, is it possible?
Because if I am able to come in, I will. And I left those for just on remote, just in case I couldn't. Uh, but I'll let you know if I can. I should be able to this Monday, but I'll keep you updated as far as email. So uh, I'll let you know if I'm coming in. Okay. All right. First question, short answer says explain how the enzyme cyclooxygenase affects the body. What is the difference between a cyclooxygenase or COX-1 inhibitor and a COX-2 inhibitor? Any guesses? So you should be able to find that on page 434, very top. So it produces prostaglandins that are responsible for chemical reactions that cause inflammation, pain, increased temperature, and so forth. So it produces inflammation, pain, fever.
What produces?
What's that?
What produces?
The COX, the cyclooxygenase produces the prostaglandins responsible for inflammation, pain, fever, and so forth.
It produces it.
It produces. So the COX-1, and you don't have to write all this, so I'm going to just explain it to you. COX-1 is present in most tissues and assists with many normal body functions, including protecting gastric mucosa and promoting platelet aggregation, which is like producing a scab. COX-2 is found mainly at sites of tissue injury. Where it helps sensitize receptors to pain and mediates inflammation. COX-2 is also located within the brain where it affects fever, pain, perception. Therefore, COX-1 can be considered as an enzyme involved in maintaining normal metabolic processes, where the COX-2 is associated with processes in which pain and discomfort are present. So, most NSAIDs, your nonsteroidal anti-inflammatory drugs, inhibit both COX-1 and COX-2. So uh, they prevent their enzymes from creating pain, from creating fever, from creating inflammation. So that's what the NSAIDs do. They cover up the COX-1 and COX-2 uh, enzymes, and the NSAIDs work on the inflammation, work on the pain, and work on the fever. So, and that's your ibuprofen, your Aleve, your what else? Ketoprofen, um, even your Celebrex, which is for osteoporosis. Let's see what else does it say. Early on, it was hoped more since selectivity for COX-2 would reduce the risk of stomach problems that are activated when COX-1 is inhibited. However, the efficacy and side effects of the drugs are actually quite comparable to traditional NSAIDs. So again, with NSAIDs, you have to take with food or with milk because it causes, stomach irritability, stomach problems. Um, and some selective COX-2 inhibitors have been removed from the market due to potential cardiovascular risk. And that was like your Vioxx. Vioxx was one of them. Let me see what it says. Vioxx and Bextra was another one. They removed those from the market because people were reporting to the FDA the side effects, and the FDA issued a drug recall in regards to that. They took them off the market. So basically, all in a nutshell, COX-1, COX-2 inhibitors or COX-1 and COX-2 enzymes create the fever, create the pain, create the inflammation. NSAIDs, when you take an NSAID, it'll help with the fever, pain, and inflammation. Number two, what medication can cause Reyes syndrome? What may this condition develop? What symptoms or reactions may develop in this condition?
We don't give it to children. It's from aspirin.
Good job.
So, uses aspirin in children.
There you go. So that's on page 429. Medications can cause the medication that can cause Reyes syndrome is aspirin. Um, Aspirin used in children may cause Reyes syndrome. This condition may develop after chickenpox or upper respiratory tract viral infection. Reyes syndrome may cause vomiting, lethargy, and encephalopathy, leading to coma and death. So it's dealing with the nervous system as well. And taking too much aspirin can cause that. Number three, what three properties do aspirin and NSAIDs have? What three properties? Um, I guess what indications do they work on? Um, yes, it's an anti-inflammatory, so that's one of them. Fever, pain. So that's also analgesic, which is for fever, and antipyretic for pain. Analgesic or antipyretic? Both of them? Analgesic,
And that's for the fever.
yes. And antipyretic.
Which one's for inflammation?
Actually, it's anti-inflammatory.
Oh, so it's
Okay, let's spell that. Victorian antipyretic. So this is mainly fever, pain, and inflammation. So that's what NSAIDs and aspirin help with. Number 4, what 3 problems can be caused by the overuse of NSAIDs? It's like your side effects. What do we just talk about? Why we have to take it with food and milk? Stomach. So can worsen stomach problems like GERD. um, I would say that's that does gastritis does, but how about what? How about ulcers? That can cause GI ulcers and can cause GI bleeding, gastrointestinal bleeding.
What's the difference between chickenpox and smallpox?
Chickenpox. Um, I don't know if smallpox is a virus. Let me see if smallpox is a virus. It should be a virus. Chickenpox rash tends to develop faster than that of smallpox. It is usually on the trunk of the body, avoiding the palms and soles. The rash associated with smallpox may start in the mouth or on the face and then spread over the body slowly. Let's see what else it says here. They might seem similar. They both cause rashes and blisters. They both have pox in their names. But other than that, they're completely different diseases. Let's see what it says. Chickenpox is still around. Smallpox is pretty much extinct. So that's the difference there. uh, the smallpox seems to be more bigger blisters. Big. It was a small flare up. I know it was in the gay community, I think, because it does affect bisexual men or gay men more than anything. Um, yeah, there's a vaccine for it, for smallpox and chickenpox. Yeah, I think when we're young, when we're babies, that's when they give it to us. Is there? I don't know. There's a smallpox booster. So there is a booster vaccination every 3 years. Yeah, when there's a smallpox outbreak. So I know that's when I heard it on the news, but it was within the gay community. from what I heard on the news. All right. Um, Number five, there's two drugs that can be used to reverse opioid agonist effects or opioid overdose. Naltrexone and naloxone. Naltrexone and naloxone. All right. How far are y'all on y'all's worksheets on chapter 17? Have I graded any of y'all's yet?
17, 19?
17. Oh, 19.
Yeah, I'm close.
Okay. I'll just check.
What did you do next week?
Chapter 19. Actually, we was trying to get it this week because we started it last week.
I can send it in online.
Okay. Well, I don't mind getting it on Tuesday. Um, I'm trying to think. So if I get it on Tuesday, I mean, we'll probably have a test on that. We'll be on that on Wednesday then for that.
Are you supposed in our Canvas before we have tests?
Do it.
Before we have tests, you're supposed to do it in Canvas?
It's in there like, let me see. See the date on the quiz, like today's date. For this one, it'd be chapter 16 quiz. Huh? Yeah, but yeah, I'm giving you an extra time to do that, to get that done. You're doing chapter 1 today, though, right? Yeah. And then you'll do chapter 16 next week. Yes, ma'am. So let's do a review. Oh. Um, for the most part on these, just like I said, I was telling you, remember the drug class for this again. This one right here on acetaminophen. These two are backwards. So actually, Tylenol or acetaminophen is analgesic drug class, and indications are for pain and fever, mild pain and fever. And remember, causes liver damage. Lindronates for osteoporosis, usually those in phosphon or phonate. So NATE, kind of keep those kind of, put those together. Allopurinol, drug class is xanthine oxidase inhibitor. So you got to remember that. Brand name to allopurinol is Alloprem. It is used mainly for gout. That's the main one I'm gonna pick for on this one. Allopurinol is for gout. And some side effects. Let's see. To reduce your risk of kidney stones. So it could cause kidney stones. Avoid drinking alcohol and may worsen your condition. Kind of keep those in mind. Aspirin, brand name Bayer. That's the one I'm probably going to use as far as the answer. If I ask for what's the brand name for aspirin, that'll be Bayer. Drug class, salicylate or NSAID. Just remember that it is a salicylate and NSAID. So used for pain, inflammation, fever. For this one, you could put. I could. What's the side effect that we take too much? But what is what are the diseases that it causes? Ray's syndrome. Ray's syndrome. But also take with food and milk because it does cause all that uh, gastric uh, uh, gastric. What am I trying to say? Messes with the stomach. You should.
Children can't have aspirin at all.
Yes, but you have to have
Baby aspirin.
food. Yeah. Are you're asking for children? Too much aspirin. They can take aspirin, but too much aspirin will cause a Ray
Like
syndrome.
more than two.
Oh yeah.
Oh.
Well,
I
like,
would give it.
well, I would say even more than that because it says what 4 grams.
Yeah. But how many do
So,
they even have to give their kids?
well, it says on the in directions. Just follow the directions on there. And but let me see what was the max dose? I think it was 4 grams. Yeah, 4 grams a day. Maximum dose of aspirin in adults is 4 grams. So I would say about 2 grams is a lot for a
How
kid.
much is one?
One pill, it's either 325 milligrams. That's 500 to 1,000.
This is 325 to 60. So it's 325
Yeah, 325. You got 325. And that's just regular strength. Extra strength was usually 500. And then you have 81 milligram. 81 milligram aspirin is usually for to treat the heart. For those who have chest pains and are open or susceptible to strokes and stuff like that, they put them on a regimen of 81 milligrams a day. That's equivalent to baby aspirin. So they use that so that it helps prevent strokes because aspirin is an antiplatelet. It doesn't cause um, clots. Clots. Yeah.
can adults get Ray's syndrome?
If they overdose on it, yeah, they can. Like overdo it, 4 grams, more than 4 grams. Remember baclofen and carisoprodol are muscle relaxants. Um, remember their respective brand names. Black baclofen is Leoracel, carisoprodol, Soma. Um, baclofen's for spasticity. Carisoprodol's mainly for musculoskeletal pain, so don't get those mixed up or anything. May cause dizziness and drowsiness. For the most part, the side effects for muscle relaxants are gonna cause dizziness and drowsiness, and also avoid alcohol with these as well, because they can alter your perception pretty bad. Celecoxib is also an NSAID, brand name Celebrex, and that is mainly for arthritis. I'll probably put osteoarthritis or rheumatoid arthritis on there. So NSAID again, take with food or milk because it does cause gastric uh, distress. Cyclobenzaprine is another muscle relaxant, brand name Flexeril. Muscle, it's used for muscle spasms, and they may cause dizziness or drowsiness. And again, avoid alcohol. Again, muscle relaxants cause dizziness and drowsiness. Avoid alcohol. Same thing with, I mean, not say on the NSAIDs, diclofenac sodium, brand name Voltaren. This one's usually used for osteoarthritis, and it's usually a cream for the most part. Sometimes it's It is a tablet, but they also make it in cream. And again, with NSAIDs, take with food or milk. So kind of remember, there's certain correlations to each drug class and side effects. Opioids, some opioid drug class, hydrocodone with acetaminophen. I'll probably use Lortab, but it's good to remember these other names as well, Norco and Vicodin, be- and just keep those in your memory, just to put those together with hydrocodone and acetaminophen. It is an opioid, and it is to moderate for use for moderate to severe pain. And for these, they do cause dizziness and drowsiness. Again, avoid alcohol. Same thing with the muscle relaxants. And these are considered narcotics, controlled medications. Remember that hydrocodone is a controlled two medication. Some more NSAIDs. Y'all do know about ibuprofen, which brand name is Motrin. Again, take with food or milk. This one you may cause dizziness or drowsiness. Meloxicam is another NSAID, brand name Mobic, for osteoarthritis, rheumatoid arthritis, and shake the suspension well before use. And again, NSAID, take with food or milk. Oh, this one's take with or without food. But for the most part, if I pick a side effect for this NSAID, I'm going to put take with food or milk. Methocarbamol is another muscle relaxant, brand name Robaxin, used for muscle spasms. Again, and it causes dizziness and drowsiness. Morphine sulfate, another opioid. For this one's for severe chronic pain. Brand name is MS Cotton. Um, MS, morphine sulfate. Kind of put that together. MS Cotton, morphine sulfate. Um, may cause dizziness or drowsiness. Avoid alcohol. This is a controlled two medication. So federal law prohibits the transfer of this drug to any person other than the patient for whom it was prescribed. Naproxen, naproxen is an NSAID, may cause dizziness or drowsiness, and also again, NSAIDs you got to take with food or milk. And indications for naproxen are a mild to moderate pain, gout. Oxycodone, OxyContin, brand name, kind of easy there. Oxycodone, Oxycontin, they almost sound the same. It is an opioid. Again, it is for severe chronic pain. And again, opioids you cause dizziness and drowsiness. Avoid alcohol because they suppress the breathing. And again, federal law prohibits the transfer. Um, Another opioid, another oxycodone. So you have OxyContin for oxycodone, and you got roxycodone for oxycodone. Um, Roxycodone's for moderate to severe pain. OxyContin is mainly for severe chronic pain. And again, opioids cause dizziness and drowsiness. Again, another muscle relaxant. This is a muscle relaxant, but the classification is alpha 2 agonist. Xanaflex is the brand name to tizanidine, and may cause dizziness and drowsiness. They just recently upped tramadol to an opioid. Brand name is Ultram. So tramadol, Ultram. That's how you kind of keep those in memory. You know, put those two together. This one again is just for moderate to severe pain, and tramadol can be taken with or without food, but take it the same way each time. Swallow a capsule or tablet whole to avoid exposure to potentially fatal overdose. Do not crush, chew, break open, or dissolve. Fatal side effects can occur if you use tramadol with alcohol or with other drugs that cause drowsiness or slow breathing. So that's again with opioids. Avoid alcohol because it could cause dizziness and drowsiness and suppress the breathing. And again, since it's a controlled medication, federal law prohibits the transfer of it. And that's all of those. So 1, 2, 3, 9, 10, 13, 16, no, 17, 18, 19, 19, 19 different medications.
I have a question.
Yes,
What's an oral biphosphonate?
oral biphosphonate. Um, that is a medication for osteoporosis. So mainly women that have gone through menopause, they tend to develop osteoporosis, which is the breakdown of their the calcium in their bones, which makes them brittle, and it helps keep their bones strong. All right, let's do a quick review. See where we are at with chapter 17 or 19. I keep on saying 17. Back.
I can't find where it talks about oral biphosphonate.
What it talks about what?
It says oral biphosphonate medication should be taken with, and I can't.
That should be
Is it just empty? They just don't keep it.
what number are you on?
Number 10 on chapter
What page?
281.
Number 10. Oral biphosphonate medication should be taken on empty stomach.
It should be on empty stomach.
Should be on empty stomach. Make sure. Insects. Here it is. Osteoporosis. Fracture. Patients should take oral biphosphonate medications on an empty stomach with a full glass of plain water at least 30 to 60 minutes before eating any food or taking other medications. That's on 438. It says in tech note on the bottom. In addition, patients should remain upright for 30 to 60 minutes to prevent irritation or esophageal damage. So like alendronate or Fosamax, that's a biphosphate, biphosphonate, bisphosphonate. And again, take it on an empty stomach, big, large glass of water. Cannot lie down for 30 minutes, 30 to 60 minutes, because it does affect the esophagus. Yes, ma'am.
I have a question.
Mhm.
I just have two questions.
Okay.
On chapter two, just like two.
Two. Okay.
On page 16, it asks what condition must be met for an individual to purchase an exempt narcotic.
What page is it?
Page 16 on the workbook,
Page 16. And what number?
number 16.
What condition must be met for an individual to purchase an exempt narcotic?
I try to find it.
Let's go back here. Chapter 2. So we're jumping to controlled medications. Let's see. Thinking it was going to be on page 42. That's lab 2.1, right? Yeah. An individual must be at least 18 years of age and must be a local resident. Um, The exempt narcotic must come in the original manufacturer's bottle, and no more than 4 ounces can be dispensed every 48 hours.
Um,
What other?
it asks what organization oversees the practice of pharmacy within a particular state.
So each state has what?
FDA.
No, there's only one FDA that controls that's federal. No, it's BOP. What is BOP?
Oh,
Board of Pharmacy. So in every state, there's a Board of Pharmacy or State Board of Pharmacy.
I'm trying to use a lab for free, but it won't allow me to look up the website.
Did I input it in there? Or did I not? Let me see.
It says right here, like, visit the website to obtain the
Okay.
state, free state board of pharmacy. But it says, like, the page can't be opened
Let me look at this real quick.
to look up the website.
Which lab are you on?
chapter 3.
Chapter 3. 3.3, 3.4.
For 3.3, I'm doing 3.3.
Okay.
No, chapter 2.
All right, thank you.
It's on page 32.
32. All right. So you're looking to fill out this right here, okay? Name of state. Does your state require pharmacy technicians to be certified? You can, you might find that in this website right here that I have in the lab, and it takes you to the Texas State Board of Pharmacy. And yes, it for the most response on the name of the state, you could just put Texas. Does your state require technicians to be certified? Yes.
And then the certification is D.
PTCB or EXCPT. And let me see where you can find that. Uh,
Is like licensure the same as certification?
which where are you reading it? Oh, does your state require licensure of pharmacy technicians? So that's your registration. So you have your certificate, which when you get it, you'll become certified. But then whenever you register to in state board, you become registered with the state. So yes, that is yes. Licensure of pharmacy technician. Is a fee required for licensure? If so, what is the fee? So we would look at, let's see, license renewals or I'd say license renewals. And let's just say license renewal fee for,
Can you see how much it is?
what's that?
How can you see how much it is? Because it's saying
Yeah.
the fee for each test.
Well, that's for the test. How often does pharmacy take each year? So for the licensure in the state, it's $84. How often do pharmacy technicians need to renew their license?
Every 2 years.
Every 2 years. So again, I mean, okay, maybe the licensor was asking for the certification from PTCB. So the fee for that one is actually 129
For
for
the
the
test approved.
for the one that we just answered fee required for licensure. That one's actually 129. Because the next one asks, does your state require pharmacy technician to register with the state board of pharmacy? Yes. Is the fee associated with the registration? Yes, that one's $84. So does your state require formal training?
Yes.
Yes.
And then it's the level of training of the pharmacist.
Level of training, let's see, must register as technicians to in training and then complete a board approved training program and obtain PTCB certification. Obtain PTCB certification.
Is yours still-
Does your state allow compounding of medication, sterile and non-sterile? Yes.
Yes, all of them.
Yes.
What continuing education? The 20 hours of education and then
Continuing education, 20 hours. Yes. The fee is the renewal fee for registration. What fees are required to be paid to the State Board of Pharmacy? The renewal fees.
what other requirements does your state necessitate?
Necessitate. What other requirements does your state necessitate? Just put none or NA for non-applicable. All right. Any other questions before the review? Yeah.
Are you taking the test now?
No, we're doing a review over chapter 19. This is just chapter 19. In the afternoon, I'll do a review over chapter 16 right before y'all take the test. And that's just matching. Just matching. Um, let's do a match real quick. Whichever you want to start at. Well, this one gives us the answer already. So, true or false, prescribers and patients use NSAIDs for mild to moderate pain and inflammation. True.
And then the drug blank is an oral that is the investor.
For this one, okay. What is a fibrous connective tissue that connects to the bones? Ligament. Most consider what the prototypical opioid pain medication? Morphine. Nerve carrying impulse from the brain. That's usually motor nerve. You don't really need to know that. What is the classification for Lortab? Drug class, opioid, analgesic. Analgesic because it has acetaminophen, but it has opioid, which is hydrocodone. Let's do another one. One of these. Answer the true false. Osteoporosis is the most common form of joint disease. That
Oh wait, hold on.
false.
Yes, it is
Should be
false.
false.
Osteoarthritis.
Which one?
Osteoarthritis.
What about it?
That's the most common.
Common one? That one, or I would say rheumatoid arthritis. So, what does osteoarthritis associate with?
Uh,
Spongy bone?
yeah.
No, that was not right. Oh, degeneration of joint cartilage and underlying bones.
And then I think the spongy bone is the skeleton.
Uh,
No, it's the
Cancellous bone, yeah. Yeah, you don't really need to know that one. Let's do this one. Cycloogenase inhibitor.
what is the classification for
Celebrex. Yes. Uh, see, the generic name is celecoxib, has that COX in it. So I'll kind of put those two together. COX2, celecoxib. And let's do this one. Skeletal muscle relaxant.
the nerve carrying impulses from the brain
This one?
Yeah.
No.
Oh wait, because that's in color.
Yeah. So skeletal muscle relaxing is what?
The
Yeah. That is the flexor or cyclobid spring. So that is a muscle relaxant. One more round. One more round. We won't do these right here. Do this one. Won't do that. Okay, so oxycodone, what is that?
oxycodone. That's is it for the C2? The trade name for
Roxycodone.
oxycodone.
Indications are moderate to severe pain. Yes. Oxycodone, roxycodone, they sound the same. Salicylate. What is a salicylate?
Is it for the drug that was
Nope.
the spongy bone? No, because that's
Yeah.
would it be the aspirin?
Yeah. Aspirin is a salicylate. So antipyretic?
It is the drug that prevents religious
Yeah. That works. And break a rupture of a bone. That one, rigid bone. Don't need to know those. Let's go back real quick. Well, thought we had one. Musculoskeletal medications. Therapeutic agents. Well, I guess it doesn't have one. Just trying to look for a Jeopardy that has musculoskeletal. Well, I guess we'll do the learn real quick. try that. So a drug that relieves pain. Antipyretic? Antipyretic? Analgesic. Yeah, analgesic for pain. Yeah, right. That's why we review. All right. So, how
What
do
are we
you?
doing in class tomorrow?
If we don't get through chapter 4, or we might start chapter 5.
I just said, because I was on campus and I just looked at this, all the things I need left out of the homework is chapter 5 in lab, and then chapter 3 lab, and chapter 17 lab.
Yeah. And worksheets. You mean
Like just,
lab and worksheets?
yeah.
Yeah.
Oh, well, I already finished chapter 3 lab. Chapter 3 and 17 worksheets. I just need to.
So you just need 5, like 5, 7. You haven't done 17.
No, I just haven't done the lab on part of it.
You finished. You finished 19 yet?
I just.
Okay. Yeah. Yeah. That's all you'll need. That far ahead. Uh, mm. A drug that prevents or reduces fever. Separated. Good job. Surgical reconstruction or replacement of a joint. You don't really need to know that. The plastic. Arthroplasty. I don't really know that one. Break or rupture of the bone fracture. You don't need to know that. Don't need to know this one. Suspension. Okay. Sure. Don't need to know that one. Guessing. So to take us back, what's the drug that relieves pain? Anal analgesic. Oh, this takes us back to that. Let me see options. Let's see what does. Either either of the two related enzymes that control prostaglandin production.
Could be. Um, how do you pronounce number 1?
Icosan icosanoids. We haven't even spoke about that, so it wouldn't be that
Could
one.
be.
We just spoke about it though when we were answering the short answers. 3 cyclooxygenase. Yeah. Feeling a state of intense excitement, happiness. That is euphoria, I would say. Don't need to know that. Okay. Painful form of arthritis characterized by defective metabolism of uric acid. So this is a buildup in the uric acid. May cause, Yep. Usually males get that. Don't need to know this. Don't need to know this. Let's try. Not what I want to go over. Let's see what else, because that's not what I want to go over. trying to find one that has the drug classes. Let me see. All right. Let's go over this real quick. This will do some of the opiates real quick. All right, question one. Active ingredient. What is this? Oh, not what I want.
I have another question.
Okay.
So, how often is the test for ECPT offered?
How often?
ECPT. Yeah, just how often is the test offered?
Let's see.
And is this one the 2 years as well? With the how long is the certification valid?
Well, it's asking how often it is offered. I mean, that's like ambiguous. I mean, that's like open to a lot of answers. Let me look here. Length of test. Oh, frequency of tests, continuous, continuous. So, how often is the test offered? It's continuous. And you'll find that on 3.1 table on page 72. That'll help you out. I guess I'm gonna just go ahead and start on chapter 4. I'm gonna leave. I couldn't find really a good review for NSAIDs and opioids. Let me see if I can find one. No, that's not all right. Let's see what this one's. Yeah, I'm gonna go ahead and start chapter 4. More stuff. Morning.
I can't remember what days you do.
Oh,
Or what days you don't. Okay, look, me and Sandra made all these for you.
oh, nice,
We laminated them
nice. Wow.
and everything.
Well, I appreciate y'all. Thank y'all.
Sure.
Wow.
For your drawer.
Yeah. Nice. It's gonna work. Maybe I can use it out in the real world. Let's see, chapter 4. All right. And this one's gonna be fast, I can tell you that. And this doesn't have much other than customer communication role of the technician with customer and patient. All right. Some objectives you'll learn. Describe the communication skills needed in the delivery of direct patient care in the pharmacy setting. Explain the communication cycle. Identify various nonverbal and verbal communication skills. Describe ways to improve vocal and verbal communication skills. Use proper telephone and cell phone etiquette and describe its guidelines. Describe the importance of written communication skills in today's workplace. Identify communication skills needed to work with special groups of people such as terminally ill, non English speaking individuals, and hearing impaired patients. Explain the significance of working as an effective team member of a team and identify ways to eliminate barriers to effective communication. All right, communication, the ability to express oneself and be easily understood. The effective communication is necessary to ensure that the customer or patient receives the correct medication. Most employers see this as one of the most important skills that a technician can have. Page 84. Well, yeah, page 84. Starting off with a scenario. Catherine is a lead technician at a local grocery store pharmacy. She's in charge of training newly hired technicians. Catherine and her supervising pharmacist have developed a 4-week program to help the new trainees integrate successfully into the pharmacy workplace. Currently, Catherine is working with Jackson, preparing for his first day on the job. Module 1 of the 4-week program is titled Communication. What topics do you expect Catherine to cover with Jackson in the first section? All right. Probably one of the most prevailing concerns of pharmacy managers and pharmacists is the need for pharmacy technicians who are competent in the area of communication. Communication is the ability to express oneself in such a way that one is understood readily and clearly. Pharmacy technicians communicate daily with coworkers, health care professionals, and customers. Effective communication skills are critical in achieving optimal patient satisfaction and trust. Virtually all employers consider basic communication abilities a prerequisite to hiring. A competent technician has excellent written and verbal communication skills. In addition, technicians are expected to use skills such as diplomacy, compassion, sensitivity, responsibility, tact, and patience. Good communication is also important for patient safety. A technician who knows exactly what the patient needs and understands how to communicate is able to assist the person with confidence and accuracy. The communication cycle involves two or more individuals exchanging information. The cycle consists of a sender and a receiver, a message, various channels of communication, and feedback. Um, so again, communication always involves a sender and a receiver. Communication cycle includes various channels of communication and feedback. The sender initiates conversation and sends a message across the channel. Examples of channels are written messages or spoken words or even body language. Good listening involves summarizing what the sender has communicated or active listening. Nonverbal communication. Exchanging information without spoken words. Facial expressions are important. Maintain a caring but professional attitude. Stress can manifest in many ways. Eye rolling or sighing shows impatience, lack of respect, and be friendly and remain calm. So for the most part, you have a patient who's coming in, maybe just got out of the hospital, or just having a bad day, or they're sick and whatever. And for the most part, you want to give them your undivided attention. You want to make sure that the communication flow is clear um, and precise, and make sure that the patient understands um, what is needed for us to fill the prescription. So whenever they come in, you'll receive the script, and you'll ask, have you filled here before? Sometimes they'll say, for the most part, they'll say yeah. Sometimes they'll say no. If they say no, then you're gonna have to get some information. You'll have to get their full name, address, phone number, and insurance information, any drug allergies, and any drugs that they are taking as well. So for the most part, you are the first person that they see when they will talk to when they come in, and you just kind of want to be open with them and not so closed to where they feel like they can't come to you for any kind of to answer any questions or anything. So nonverbal communication, again, facial expressions are important. Try to leave the eye rolling at home or sighing, and just be friendly and remain calm. Verbal communications, there's two parts, vocal and verbal. Words alone don't convey meaning, so you need to pay attention to the pitch, tone, speed, and volume. I was looking at my watch the other day, and it it kind of well, it does track your tone of voice if you turn it on. So like it's kind of weird how that works. If it'll let you know if you sound angry or if you sound happy or relaxed or content or whatever. It was I was really surprised as to how it um, justifies or yeah it I mean
It's kind of weird. Like, how can you tell?
how does it tell and just the way the tone of voice, I guess. Let's see, let me look here. Examples of negative body language. So I'm on page 85 on chapter 4. Miss Lehman walks up to the counter to have her prescription filled and asks whether it can be done within 5 minutes because her bus will be leaving. John, the pharmacy technician, rolls his eyes and shakes his head in disbelief, wondering why patients think they should never have to wait. He turns and walks away without saying a word. The alternative response, John should have shown concern for Miss Lehman and tells her that her prescription will be filled as soon as possible. John can ask the pharmacist to please fill the prescription as quickly as possible. We tried to help out those who are going out of town or whatever, but for the most part, usually the wait time is at least 20 minutes for
And then when you push the button
small pharmacies.
in the drive-thru,
And then you're waiting for almost an hour. Yeah. That's because we're so short-handed everywhere. We're short-handed everywhere. So once y'all become certified, you can fill in those gaps.
my mom worked at Luker Pharmacy.
Did she? She was a technician?
Mm-hmm.
Oh, okay.
But they closed. Like, I
Yeah.
guess they were sold out.
Oh, okay.
They sold out.
Yeah. Yes.
I can't find it.
Okay. Chapter are you on? Okay. Let me get through this and I'll get back to helping you out real quick. As far as how to improve your vocal communication skills, speak slowly rather than rapidly. Don't mumble. Use calming words. So kind of have your tone, don't be all loud. Um, you don't want to scare people or because of your tone. Put yourself in the other person's shoes. That's we should do that a lot. put yourself in another person's shoes, and avoid speaking in monotone. How to improve your verbal skills. So read to increase your vocabulary. Take a communications course, which you'll probably take a speech course when y'all get into college. Use communication aids such as CDs, DVDs, and internet sites. Put yourself in the customer's position. Sick customers may not be able to control their emotions. All right. Go look at the tech note on page 86 down here. Remember, customers can choose where they want to fill the prescriptions. Many choices are available to today's consumers. If patients can essentially get the same medication at numerous pharmacies, what is a deciding factor in where they take their business? When all things are equal, such as the price and availability, pharmacy staff is what makes the difference. People want to shop. People want to shop where they receive warm, friendly service and where the staff knows their name. Technicians could be that that difference. As author and motivational speaker John C. Maxwell said, people don't care how much you know until they know how much you care. Um, so be careful of the words you use while addressing a customer. If the customer is definitely wrong, do not tell the person that he or she is wrong. Instead, after carefully listening to the customer, point out the misconception to let the customer know that you understand how this point could be easily confused and determine which of the scenario oh says determine which of the scenarios following boxes is appropriate. So let's look at option one on page 86. When I called earlier, they said this is the customer. When I called earlier, they said the prescription would be done by noon. Now you tell me they aren't ready. Why do you guys lie like that? The technician says, we don't lie. He probably called in late. Customer, oh no, I think I called it in around 10 a.m. And the tech says, well, either way, you will have to wait. And the customer says, let me talk to your manager. Here's the option two as to that scenario. When I called earlier, they said the prescription would be done by noon. Now you tell me they aren't ready. Why do you guys lie like that? The technician should have said, I'm sorry. I know the automated system said they would be done by noon, but that's for prescriptions that were called in by a certain time. Did you call in your prescription before 9 a.m.? Customers response, oh no, I think I called it in around 10 a.m. The technician responds, that's okay. Let me go take a look to see whether we can get your prescription ready for you as soon as possible. And the customer thanks so there's two different scenarios. Of course, the one that helps out the customer is going to be the most approved one. Um, and that's what we try to do. We want to show empathy towards the customer. Again, put yourself in their shoes and try to get them on their way and try to de-escalate that rudeness from the customer. Tech note on page 87, always treat customers as you would want to be treated. Remember to be kind, courteous, and respectful at all times. Optimize your communication. Use open-ended questions to avoid errors and mistakes. Um, Here's an example. Use open-ended questions. This gets you more than just a yes or no answer. It shows the patient that the conversation is not just one way, that you care about his or her perspective. If you can get a dialogue going with your customer, you may be able to avoid potential errors. For example, if you ask, do you have any allergies? The customer may just say no or shake his head. However, if you say, what type of medications are you allergic to? The customer will give you a more detailed answer. So use open-ended questions. Treat the patient customer with respect and be honest. Provide empathetic responses. This shows the customer that you can see the situation from her point of view or their point of view. When a patient thinks you understand how he or she feels, he or she is more inclined to share information that could assist with her care. For example, you might have a patient who had a long wait to see the physician with her sick infant. She is clearly stressed and is now waiting to pick up the baby's medication. She asks you why it is taking so long to get one bottle of medication. An empathetic response might be, I know you must be exhausted from all of this waiting. I assure you, we are working diligently to get your child's medication ready. Um, Helping her get well is our goal. Also, again, give empathetic responses and avoid distractions while communicating with patient customer. Uh, Again, minimize distractions. The goal for every conversation you have with the patient should be to communicate clearly and make sure your message is understood. If needed, take the patient to a quieter space, such as a design counseling area, to answer any questions or clarify instructions. For example, you may have a patient who has received a prescription for tadalafil or Cialis. You ask if he would like to speak with the pharmacist about this new medication. He is hesitant because there are several customers within hearing distance. You should suggest that the patient speak with pharmacists in the counseling area, which is private and away from other customers. All right. So we jump to telephone etiquette. Again, you want to show respect to the colleagues in the health field. You will be talking to nurses, doctors, insurance agents, and whatnot. Um, Etiquette is unwritten guidelines or rules. Check back with customers on hold. And you will have a lot of people on hold because they like to call, especially in the mornings. Telephones involve only verbal communication, so there are no body language clues. Use a pleasant tone and good listening skills. Clearly identify yourself. Good morning. Thank you for calling CVS. Thank you for calling Walgreens. This is Ray. How can I help you? So you want to clearly identify yourself. Determine the reason for the call and whether it is within your scope of practice. So as far as to determine the reason, it might be a doctor, and he might be calling in for a new script, a new prescription. So if it's a new prescription, you're going to have to transfer that to the pharmacist because we cannot take the prescription. Take note here or take alert on page 88. Currently, there are 17 states where it is legal for pharmacy technicians to take an oral prescription from a prescriber and 4 states where they can administer immunizations. As the technician field evolves and more states require formal education, there is reason to think that technician responsibilities will continue to increase. Like I said, there's a point in time where, as a technician, and this is again years under your belt as well, and you could become a lead technician, oversee all other technicians, create a schedule, and you just want to make sure that each one of them are giving good communication to others, um, and show their responsibility. Um, as a lead tech, you might be one of the ones chosen to check other people's work, other technicians' work. So you do want to make sure if you are in that position where you're checking off technicians' work, you want to double or triple check their work. Um, and if they're wrong, you want to send it back to them and let them know why they're wrong. And again, proper etiquette, proper communication helps out with that. And you don't want to be condescending or anything like that. Just help them with what needs to be changed uh, in order for the prescription uh, to be okayed and issued out to the patient. Take note on page 88 again. Be sure to check with your supervisor about cell phone policies or in your workplace. Always um, err on the side of caution and stay off your phone during work. If you're doing IVs and sterile compounding, you're for sure not going to have your phone in that sterile compounding area. For the most part, if you're real busy, you want to stay off your phone. Of course, unless there's emergencies or whatnot. Cell phone etiquette again. Cell phones can distract from customer care. Do not text. Do not text or call or talk on the cell phone while working. Focus 100% on the customer in front of you and keep cell phones out of sight. Keep phones on silent or vibrate. Never talk or text while filling prescriptions or dealing with customers. And keep personal calls to a minimum. Written communication skills. I'm going to read up on the take note on page 89 here. Always be sure to get as much information from the caller as possible when taking a message. Be sure to include the date, time, and your initials to avoid confusion. Although a pharmacist needs to check all transcriptions and calculations, it is important that the technician have a good understanding of how to take a message to avoid medication errors. Um, Written communication skills document everything accurately and clearly. Poor handwriting can cause errors, and we see that a lot with prescribers. The more detailed, the better. Get all required information initially to avoid callbacks or repeat questions. And be sure messages are accurate and legible. Communication with special patient groups. You have terminally ill. 5 stages of grief. There's denial, anger, and bargaining, depression, and acceptance. Each stage manifests at a different time and can last for any length of time. Um, Starting off on 89, where it says communications with special patient groups. The goal of communication should be to understand and to be clearly understood. Um, the technician should be sensitive to each customer and alert to any special needs the patient might have. This role begins when the technician greets the patient and accepts the prescription. Uh, s- Terminally ill patients, special consideration should be given to patients who are terminally ill. Remember that they may be feeling overwhelmed, although each person copes with his or her own mortality differently. There are normal progressive steps that people experience. The 5 stages that terminally ill patients experience are as follows: denial, this can't be happening; anger, it isn't fair; I don't deserve this; bargaining, please make me better, and I promise; depression, I will never be able to see you again; or acceptance, I can do this, everyone does. Normally, the first stage is denial. This is a defense mechanism in which the situation does not seem real. Perhaps reality is too harsh for the person to accept. The next stage is anger. Sometimes one may have a feeling of unfairness. Bargaining usually follows anger. The person makes promises to himself or herself or to a higher power in the hope of a miracle. And depression may take over at this point with the realization that nothing is going to change concerning the prognosis. The final phase is acceptance, in which the person concedes his or her own mortality and prepares for eventual death. Each of these stages can manifest at any time and last for different lengths of time. Therefore, it is important that the technician be compassionate to the patient's situation. Most healthcare workers do not hesitate to help a dying patient, However, the problem is how to identify these patients. Unfortunately, unless the patient decides to share information, the pharmacy staff does not necessarily know. Some medications indicating an advancing medical condition. These include pain medications such as fentanyl patches or morphine. However, these drugs do not definitively identify a fatal condition. Therefore, the pharmacy technician must be objective about each person who enters the pharmacy and realize that he or she does not know what each person is experiencing. All right. Non-English speaking patients. Effective communication is important for safety and compliance. Pharmacy may employ bilingual staff, hire interpreters. Um, Higher pay goes with if you're bilingual. So if you're able to learn a second language, use that to your advantage. Use software that translates prescription labels. Um, going to start reading here on page 90, non-English speaking patients. We live in a culturally diverse society, and technicians often encounter customers who do not speak English as their first language. Technicians who speak multiple languages are in high demand and can play an important role on the pharmacy team. Statistics show that more than 8.6% of the U.S. population speaks English less than very well. Millions of prescriptions are written for people who have limited English proficiency each year. For safety and compliance purposes, it is critical that the pharmacy technicians, pharmacists, and limited English proficiency or limited English proficiency patients communicate effectively with each other. There are many ways pharmacies can help facilitate appropriate communication with these types of patients. They may employ bilingual staff, provide interpreters, or use software programs that translate the prescription labels and information into various languages. Some pharmacies use pictograms to illustrate a variety of instructions, um, and it gives an example on that. Take note, consider learning a foreign language, such as Spanish or Chinese, to increase your employment options. Another take note, consider enrolling in a local American Sign Language class to enhance your ability to communicate with your hearing impaired customers. So, communication with special groups, hearing impaired patients, ask about and document communication preference. Write legibly if the patient wants to use notes. May be difficult for them to read written in English if they're not English speaking. See if an interpreter is available. Always look at the patient as you speak and have a positive attitude. Another important aspect of communication is communication with the healthcare team, your colleagues, extensions of the healthcare um, team, the nurses, doctors, insurance agents, other pharmacies, other techs, other pharmacists. Be an effective team member. Understand your duties and responsibilities. Be positive. Stay current in your field. Be cooperative. Put yourself in other person's place and be loyal and build trust. Um, wow, you are moving right along there. So, communication with the healthcare team on page 91. Today, the pharmacy technician is an important member of the healthcare team. Thank you. In the retail setting, the team may consist of the technician, the pharmacist, the pharmacy manager, counter personnel, and other store employees. In the institutional setting, the team may include technicians, pharmacists, and managers, physicians, nurses, and other departmental personnel. In all pharmacy settings, teams work to provide the best patient care possible. The team leadership establishes clear expectations for each member's responsibilities. Trust and communication are key components of a successful team. Here are a few tips to help you become an effective team player. Make sure you clearly understand your job duties and responsibilities. Take time to discuss the pharmacy's goals with the team. Become a positive part of the decision making process. Stay informed and know the channels of communication. And be loyal and work to build the trust. And we'll finally, the eliminating of communication barriers. Effective communication is challenging in today's workplace. As discussed earlier, there can be many barriers, such as those involving language differences and hearing impairment. The first step in eliminating these barriers is to recognize that they exist. Then it is the responsibility of each team member to be knowledgeable about the techniques used to overcome these obstacles. We live in the information age and have access to many devices that help us communicate. However, much of this information exchange lacks real meaning. Real communication occurs when both the speaker and the listener are fully engaged. The best defense against any communication barrier is a strong cooperative team. Take note, technicians must never assume patients understand medical jargon or pharmacy terminology. So recognize the barriers exist. Be knowledgeable about the techniques to overcome obstacles. A lot of today's communication lacks meaning. Speaker and listener should both be fully engaged and be a strong cooperative team member. And that is the end of chapter 4. So basically, show empathy. Put yourself in the patient's shoes and try to help out as much as possible, even though if you're bombarded with other work. If you have an irate patient, you want to get them out as soon as possible, and the sooner they get out, you can go back to what you were doing, uh, and no, hopefully, no other people are going to disturb you. All right, 10:36. So I'll let you finish up your work. Keep on keep on doing that. Wow. And that's because we haven't even done chapter 17 yet. Oh, questions. You still have that question? What was it? Yeah. What chapter again?
No, it was chapter 19.
Chapter 19.
It's the 283, the matching.
What number?
The question,
Yeah, what number? What were you looking
I can't, I found 11, 12, 13, 14, but I can't find
Can't find 17? 17 is the bisphosphonate. That's probably why, because it was in that tech note, probably.
And I can't find 19.
19. See, 19, my calcium. All right. So what are we looking for? Our match drugs with their classification. So my calcium. So you can find out that on page 439 in the table 19.3. And you see where it says calcitonin hormone analog.
Well, I know where, I see it says that, but there's no osteoporosis on the side.
What do you mean osteoporosis?
Because it's medication for osteoporosis.
For 19? But look, calcitonin hormone analog. It's asking for the drug class. So 19, calcitonin salmon, drug class is calcitonin hormone analog, which is letter B.
Looking at this,
Do you think these are the drug classes? Calcitonin hormone analog, calcitonin salmon, or calcitonin. This is a calcitonin hormone. Calcitonin. Oh, that's the drug class. Looking for the drug class. Well, you could- let's see. Into the inventor, uracil acid.
that's what I was confused because I thought I was
Yeah, each of these is a drug class. All right. Get to grading. Go ahead and stop this.